Namaste everyone, myself Dr. Supreetha Gautam. Today I'll be going to speak about the topic postpartum care in present era. So firstly let us try to understand what is postpartum care in Ayurveda. The woman who has recently delivered a child and also the placenta is termed as Sutika according to Acharya Kashyapa in Ayurveda. So the woman who has recently delivered the child is very susceptible and needs a lot of care. So her health is given utmost importance in Ayurveda. The Sutika Kala is mentioned according to different acharyas in our text. The duration varies from different acharyas. They have different opinions. The Acharya Charaka mentions no specific duration, but Acharya Vagbhata and Sushruta mention 1.5 months. If there is a normal delivery and the mother is quite normal, then the 1.5 duration of Sutika Kala is mentioned. So the Sutika Kala is a phase wherein she regains her strength and also gets back the pre-pregnant state. So this Sutika Kala duration is 1.5 months according to Sushruta and Vagbhata, and according to Kashyapa it is 6 months, because he tells the Dhatu Shaitilyata, that is the tissues nourishment and also the body strength and the blood loss. Owing to all this, he recommends 6 months of duration of Sutika Kala. So this phase she has to take care with certain specific regimen of food and lifestyle and also aushadha, which is very much important during this phase of her life. Certain factors are mentioned in our Ayurvedic text regarding her the Sutika, how she would get back her menses, because post the delivery many women struggle with this issue. So this issue, there are certain factors which are responsible, because after the delivery the woman becomes very emaciated and she will have a shunya sharirata, that is she'll undergo a lot of tiredness and there will be a lot of loss of strength. So hence the factors, there are certain factors like Garbha Vriddhi. She will be nourishing throughout the 9 months, she would be carrying the in her womb, nourishing the fetus. So hence her body becomes emaciated, and later there is Sarva Sharira Dhatu Shaitilyata. So all the tissues would have lost its strength, and also the to regain Sutika Paricharya is told. Then there will be Rakta Nisrita, Kleda Rakta Nisrita. So she would have lost lot of blood during the delivery time. And also because of all these factors, there will be loss of strength, there will be disruption in the hormonal imbalance. Hence, there will be delay in certain menstrual cycle. So these factors, owing to these factors, Sutika Paricharya becomes very important for a woman to follow and to have better strength and to get back her pre-pregnant state. According to Acharya Charaka, Sutika Paricharya is in two ways, that is internal and external modalities. So internal modalities, he has mentioned the use of sneha, that is Grita, Taila, Vasa, Majja, the fatty preparations. Along with this, any one of these can be used according to her capability of digestion, because in Ayurveda without much digestion no proper nourishment can happen. So Ayurveda always believes in better digestion. So the Agni Vriddhi has to be done. During the Sutika Kala, the woman has very Manda Agni, that is a very low digestive fire. So during this time she has to have the Sneha along with certain carminative drugs like Pippali Mula, Shringaveda. Certain kind of these herbal drugs has to be, powder has to be mixed with this in equal quantity, and she has to take them. This preparation, post this preparation, Acharya Charaka has recommended Grita Yukta Yavagu. Yavagu is again a carminative, strength promoting preparation. This Yavagu preparation is very important because it nourishes her dhatu, and also as she is a lactating woman, she requires good nourishment. Later after this, she can have Lagu Annapana and also Brahmana Dravyas. Hence, only after digestion of this, she can have the Brahmana Dravyas. So this kind of regimen she should follow for 5 to 7 days. So external modalities which Acharya Charaka has recommended is Grita Taila Abhyanga. Abhyanga is nothing but the oil massage to the abdomen. So to control the vitiated vata, which increases after the pregnancy or after the delivery, to control the vayu or the pain, the Acharya Charaka has mentioned the Grita Taila Abhyanga over the abdomen. So any one of them or alternately it can be done. Later Udveshtana has been recommended. Udveshtana is nothing but tying up of a big clean cloth around the abdomen to compress the abdomen and to get back the physical fitness, and also to control the vitiated vata. So the empty space in the stomach can be well controlled and she can feel better. So this is recommended. Later Rakshobhna Karma is also recommended because she is very susceptible to certain infections at this time. Hence Agaru, Guggulu, Dhupana is recommended. Acharya Charaka further elaborates that before and after Snehapana, Yavagupana, that is a certain kind of medicated soup which can be carminative and health promoting and also nourishing is advised. After that, he has advised Parisechana, that is sprinkling or having warm hot water bath. So this helps in controlling the Vayu. Then according to Acharya Sushruta, he has a little different opinion. He recommends external and internal therapies for Sutika. The firstly he tells regarding external that she should have Abhyanga and Parisheka. So Pariseka is pouring the hot medicated waters over the whole body to control the vata and also to regain her strength. So the Abhyanga is recommended with Bala Taila because the Bala has to be improved. Bala Taila is recommended, and the Pariseka is recommended with Vatahara Dravyas because there is increased vitiation of Vayu in her Sharira. Hence the Pariseka therapy is recommended. Later internally she has been told when she gets hungry or if she has more of vitiated doshas like Kapha and Pitta along with the Vayu, she has been told Pippali Mula, Chavya, Shringavera, all these powders along with Ushna Gudodaka. This preparation gives her better strength and also gives her carminative effect on her digestion because she requires Agni Deepana along with the food which nourishes her because she is a lactating woman. So this is told for a certain time, that is only 2 to 3 days. Later Sneha Yavagu has been recommended. The same Sneha Yavagu is a similar preparation which is like medicated soup along with Sneha, that is fatty preparation, so that it can control the Vayu and also nourish her. So after this Shali Danya, that is rice or Lagu Annapana has been recommended. Post this she can have Yava, Kola, Kulatta. These are all the drugs like barley and Kulatta, horse gram. These soup along with Mamsarasa has been recommended because Mamsarasa has been told by Acharya Sushruta for Brahmana purpose, that is to nourish the Shaitilya Dhatu, which are to regain her strength and also to promote nourishment. So this pattern of diet has been recommended by Acharya Sushruta. So this has to be followed post delivery. So for first 2 to 3 days Ushna Gudodaka with Pippali Mula, then 3 days Sneha Yavagu. Post that she can have the Brahmana Dravya, that is Mamsarasa and Shali Danya, Lagu Annapana. Acharya Kashyapa opines differently compared to Acharya Supreetha and Acharya Charaka. In this, he has given Samanya Paricharya and Vishishta Paricharya for Sutika. In Samanya Paricharya, he recommends external and internal modalities of treatment. So in that he has encouraged for Nubja Sthiti, that is the women who has recently delivered should sleep in the hunchback position. This position he would have recommended for the compression of the abdomen and also for better sleep, because the women would have lost her strength and would not be able to sleep in other positions. The second one, he has told Abhyanga and Mardana, just like other acharyas, because Abhyanga and Mardana help to relieve the pains all over the body and also to get back the strength. So to the back and the abdomen, flanks, all the places, Abhyanga with Bala Taila has been recommended. Later he has told about Patta Bandhana, that is the tying up of the waist with a big clean cloth around the abdomen to control the Vayu and to compress the abdomen, the empty spaces, and to get back the fitness. So later he has recommended the internal modalities, and before that in external he has also told Yoni Snehana and Yoni Svedana. So the women who has recently delivered, she will have a lot of pain in the Yoni Pradesha, that is vaginal area. So to that area he has recommended the Bala Taila in a leather bag, and she has to sit on that leather bag for a certain time. So this can help her control the Vayu which gets vitiated, and also the Svedana with Priyangvadi Gana Dravyas has been recommended. In internal part, he has recommended Manda Sevana. So Manda is a kind of preparation which is very light for digestion. It's rice water basically, with the carminative drugs like Pipali, Shringavera can be used. Later he has recommended Yavagu Sevana. So this Yavagu also along with the drugs and Sneha, along with Sneha it can be used. Sneha is Grita or Taila, based on her digestion capacity it is recommended. Again Sneha Yavagu has been separately mentioned. So after the Yavagu, Sneha Yavagu has been told. So after this she can have the Mamsarasa or the Brahmana Dravyas. This kind of regimen or the diet has to be followed for around 3 to 5 days after the delivery. Then later she can come back to the normal food. So this kind of Samanya Paricharya has been told by Kashyapa. Then hot water bath has been also recommended because the hot water bath gives bala and it's also carminative in nature. Later after this he has told the Vishishta Paricharya based on Desha, Anupadesha and the Jangala Desha. In Anupadesha, because of the predominance of Kapha and Vayu, he has recommended not the use of Sneha but the use of Manda. Manda can be used instead of Sneha because it is easily digestible and there is more predominance of moisture in the air, so he has recommended that. But in Jangala Pradesha, dry areas, we can continue with the Snehapana, Sneha Yavagu, Snehana, Svedana and Abhyanga, followed by hot water bath. So all this Paricharya which I elaborated until now, how is it relevant in present era? So the benefits of this Paricharya, Sutika Paricharya, helps a woman regain her strength, and also she is able to lactate well and keep her health lifelong, prevent many chronic diseases. So to know regarding certain benefits, firstly it helps in Garbhashaya Shuddhi, that is it helps in cleansing the uterus. The Paricharya has certain drugs which is recommended so that the uterus has regains its lost strength, and also the recommendation of Dhatu Paripurnata, because there is a lot of Dhatu Shaitilita happening in during the post delivery time. So the lost strength or the nourishment of the body is regained. Hence, the foods like in present era, which we have fast food or oily food, junk food, it has to be avoided. So, if when we avoid certain kind of these foods and get back to this paricharya, we prevent from many rogas. That is 74 types of Sutika rogas are mentioned in our Ayurvedic text. So these rogas can be prevented. Definitely she can help lactate better, and also the dravyas which are mentioned in Sutika Paricharya help for stanya utpatti, that is better breast milk production. Nowadays we can see post delivery many people struggle with having proper breast milk and go for alternate methods. So this paricharya following also helps to nourish her body and also improve her child's health and immunity. Later, it also in cosmetic way she will have a better fitness. So this paricharya following is very important even in this era, not just present era, in future also she can prevent many chronic diseases like back pain and the joint pain and weakness, infertility, irregular menstrual cycle. All this can be prevented with proper diet and lifestyle changes. And certain aushadhis are recommended during this phase like Jeerakardyarishtam, Dashamoolarishtam. All this promote her strength, control the vayu, and ashwagandha tablets and churnas are recommended to give her good stamina and good sleep, and also for mental well-being. So all this can hamper her mental well-being also. So in present era we are coming across a lot of postpartum hair loss and insomnia, postpartum depression, postpartum anxiety. All this can be prevented if she follows the proper Sutika Paricharya. Later, also this kind of Paricharya helps for the immunity and punarnavikarana of her body. So she can get back to her shape and also improve her immunity, because in this case the kind of diet when she follows, the Agni Deepana happens, that is the carminative effect helps her get back her strength. Hence all the Uttarottara Dhatu Poshana happens, the tissues are well nourished, the body gets well nourished, so she gets better strength and immunity. So this way she can prevent a lot of diseases. And also a nuclear family like these days, because of lack of support and all this self-sufficient, they want to do every work by themselves. All this has to be somewhere she requires good support and strength, because without at this time the way she take care of herself, later part of the her life she will have better health, because she can prevent many diseases. Otherwise, she can fall prey to many lifestyle diseases, diabetes, hypertension, obesity, fatty liver. All this nowadays are very common. But with proper lifestyle changes and this diet regimen, she can definitely prevent and have a better life. So, only with Sashakta Nari can we have a Sashakta Parivar. Thank you.